an update on storm response. I did speak with Delmarva Power just before this press conference and was advised that the vast majority of service has been restored here in northern Newcastle County. I know those customers and our constituents have been out of power for several days, and we appreciate your patience with that. Very severe damage with lots of trees down, particularly in western Newcastle County, stretching from Greenville around towards the Concord Pike area and even east to the Delaware River. So I believe we had confirmation of a tornado touchdown there on Friday, and certainly experienced significant winds and damage in the city of Wilmington and Brandywine 100 and west towards Newark and Pike Creek. So with that, AJ, you want to give us an update there and where we stand today?
Will do. So thank you, sir. Definitely a very eventful week weather-wise. We had the tropical storm Isaias that came in the week, and then on Friday, knew we had the potential for some severe storms, and had two storms that merged together in the northern part of the state, northwestern part of Newcastle County, and really created a rainmaker as well as a tornado. One few areas that the University of Delaware Environmental Office report out on received over an inch of rain in 5 minutes, which is of historic levels. So going back to Tuesday's tornado, we have had 3 confirmed tornadoes in Delaware in the last week. Just so you know, our average over the last 50 years is 1 per year, so very eventful and a very severe week. The National Weather Service has their preliminary reports out with 3. There may be more that they're still looking at. Radar images, they were on the ground here last week one day and also Saturday, as well as we provided them some aerial footage for them to look at that and make their final determination. So on Tuesday, we had the one that came from Kent County up through northern Kent County into southern and central Newcastle County. Went 29.2 miles, so kind of something that you would expect to see in the Midwest and not necessarily in Delaware. Substantial damage with that. Again, I mean, hundreds and thousands of trees that have been knocked over. We understand that debris removal is one of the huge issues right now, and we're working with our state legislators. We're working with the Solid Waste Authority, with DelDOT, with others to see what, if anything, we're able to do to assist, because it is, we understand people have insurance. We also understand there's a gap there as well. So we're trying to see how we could assist with that. Luckily, with our partners, and when I say partners, I'm talking about the power companies who really did a remarkable job. We had 60,000 power outages at the peak of the Tuesday event. They got those down to just about nothing very quickly. They were wrapping up operations on Friday, and then 2 hours later ramped back up when the system came through northern Newcastle County. Our partners at DelDOT, the fire service, I won't tell you how many fire runs were responded to between Tuesday and then Friday's events for either damage to structures, tree into a house, water rescues, etc. But commendable work by all those responders that were out there. And then let's not forget our volunteer organizations that we work with every day, the VOAD, so the volunteer organizations active in disasters, the American Red Cross that was able to provide sheltering for several families that had no place to stay and help them, on the path to recovery, as well as the health and social services. Not that they're already busy with the pandemic, but they're helping individuals that have needs that have a gap right now. So then we go to Friday's event, very quick event between about 5:30 and 7 o'clock. A lot of rain in the Hockessin and Greenville area. Again, a lot of tree damage and another tornado. And again, their weather service is still looking at something a little farther east in the county as well. So, if anything, this hopefully reinforces a few things for people. When you get the weather alerts, whether it's on your phone, on TV, or radio, seek shelter. Tornadoes are not something we want to, take the chance of that it's not going to hit you. Secondly, we ask people, I said a few weeks ago, we got to make sure people are prepared. State works on our plans. We need the individual to do what they can do as well to lower that risk. And then lastly, kind of what I will lead up with, 2 things is Kent County, Newcastle County are working with a lot of organizations to try and get help out to those people that need it. Yesterday, we teamed up with a nonprofit called Crisis Cleanup. The numbers right there, 844-965-1386. And the emergency manager for the city of Dover, Case Ass, has done a remarkable job working tirelessly the last week. And one thing was, how do we get our heads around who needs help and how do we triage it? Well, that's where crisis cleanup comes in. So anybody in Delaware right now could call this line, register kind of what their needs are. There's no guarantees we're going to be able to assign people to it, but between the volunteer groups like Team Rubicon, American Red Cross, and some others are still trying to get in state to help, at least we could understand what the needs are out there and, you know, get a better picture of what's going on. Lastly, we've had a lot of questions about, will this be a presidential disaster declaration? We are doing damage assessment. We've been doing damage assessment since last Wednesday. We have 30 days from the date of the incident to request that through the governor to the President of the United States. There are certain thresholds we have to meet to request that. We are trying, and again, both these incidents are separate. So what happened Tuesday is one incident, what happened Friday is another. But we will go through, we're doing our damage assessment at the counties and the local municipalities. We're taking as much information as we can from our partners to see what position paper we could put together to try and get the assistance to people. And a lot of times that doesn't come for 30, 60, 90 days, but we're going to do everything we can to put that argument together and then discuss it with the governor as we collaborate that information. So in closing, there's still over 2 months of hurricane season left, and I think we can't underplay it, especially there's fatigue amongst a lot of our volunteers out there and the responders, and we need to make sure everybody takes this stuff seriously. So, sir, back to you.
Thank you, AJ, and thank you for your team and their good work, and thank you for recognizing all the workers for DelDOT. They did a tremendous job. I was out touring the various damage on Sunday and on Wednesday of last week. City of Dover, we appreciate the partnership there. And we're extremely lucky. The damage that I saw, particularly there south of Dover around Moores Lake, we're lucky that there weren't more injuries and fatalities. We did sadly have one fatality in, I think, the Milford area. And so just take those precautions that are necessary. I did talk to a lot of my neighbors there in the neighborhood I live in Wilmington that got into the basement as they got the warning, and was the appropriate thing as we saw trees fall on houses, and which could have really injured people in a very serious way. So thank you for that. Again, thanks to the first responders, again to DelDOT and the crews that were out there working so hard over in the heat on Sunday and over the weekend, so that we could get folks back. The partnership that we have with Delmarva Power and getting our roads cleared and opened, and electric back to homes that had lost power. So thank you to all the folks that were involved in that, and thank you to all the Delawareans who were affected for your patience. This is really an unprecedented situation. It's something I haven't seen in my lifetime, the kind of destruction, back-to-back storms like that. We average maybe one tornado a year. We had 3 in the course of a week with the tropical storm that went through and the summer storm after that. So let's go to our data this week. The numbers are looking good this week. Total cases are flattening out. They are continuing to rise. I guess it's 16,000. Still 186,000 negative tests, and while our number of lives lost continues to slow, each life is precious, and we continue to lean into protecting our vulnerable, particularly senior citizens and those in long-term care facilities. Hospitalizations continues to be a strong point where we are down to 35 current, which is one of the lowest levels that we have had since March and the beginning of the pandemic here in Delaware. So we look at the cases across the state, or the positivity, 3.8%. Again, our target is to be under 5%, and so we're moving solidly below that. We're down to 65.6 new cases per day on the 7-day moving average. That's considerably below the gating criteria for quarantines in New Jersey, New York, and and Connecticut, which we talk about a lot, that cutoff is at 97, so comfortably below that, and expect to hear that we're once again off the lists in our surrounding states. 7,200 new cases or cases overall in Newcastle County, and staying about on a reduced level of increase. Same with Kent County and Sussex County as well. So we've pushed down the outbreaks that we've seen in Sussex County. Things are starting to flatten out. Again, if you look at the demographics, though, you can see that young adult demographic is where we saw that acceleration in late June and early July, and it continues to increase at a rate greater than all the other subcategories. So again, we need folks that are in that young adult demographic to think about being careful when you're in bars and restaurants, when you're in public spaces, wearing masks, and being serious about protecting your neighbors and yourselves from the virus. Here's our data dashboard. Again, hospitalizations, we've got every one of our indicators on a good 14-day downward improving conditions. Current hospitalizations, again, one of the lowest levels that we've had in the last 5 months. The new hospitalizations, they tend to go down on the weekend, tick up a little bit on Monday, and that's what you're seeing there. Our percentage of people who are testing positive continues on a nice improving condition and decline. So we're at about under 4% there on our 7-day moving average. New positive cases, again, as I mentioned a minute ago, are decreasing as well. And then you can see the classic peak and then improvement, the flattening of the curve. The little uptick that we saw after once we started opening, particularly in the beach communities. If you look at the 90-day view, you can really see this. Current hospitalizations consistently moving down from the peak of 337 back in the last week of April. Our new hospital admissions tend to be up and down, as you can see in the top middle chart. And then the percentage of people who test positive, again, the peaking, then the decline. The little increase there that we saw back in the June, July, associated with mostly with beach bars and restaurants and people going back to vacations, and then we flattened that curve out nicely and have, again, pushed down the new positive cases on the bottom far left, consistent with our efforts to get folks to wear masks and to observe social distancing. This chart is the percentage of persons who test positive over the since late March, the beginning of this spread of the virus in our state, with a peaking at the end of April. That was the high point of our hospitalizations as well at 337, then a very pronounced decline after that in through May and until June 1st, where we started to reopen again. Saw the little uptick in the end of June, driven mostly by beach communities, and then we've effectively pushed that down again, and we're on that downward trend. And that's really where we want to stay. We want to continue to get better, to improve conditions on the ground with the focus on getting our children back in school in the fall in a way that's safe for teachers and staff, children alike, and that we can reopen and get businesses back online. Here's our data dashboard for PPE, personal protective equipment. The glasses are all full, and AJ, I think we're doing pretty well there. We've already shipped out. We get a lot of questions about PPE for school personnel. We've shipped all that out to them, and so they should be ready to go.
Correct.
With PPE, and so much of our effort today is focusing on getting children back in school safely, protecting teachers and staff, and enabling parents and others to go back to work in person and get our economy moving again. And we're prepared to do that and really economically accelerate off these improving conditions in our community. As I said, compliance with mask wearing is improving. You can see it anecdotally. You know, if we had data and testing, I'm sure it would prove this to be the case, that the vast majority of Delawareans, really no matter where, particularly when you're in public, but most places that I run into folks, I see folks following these guidelines. I think that mask wearing compliance is increasing across our country, certainly in our region. It's increasing in the YMCA gym that I go to. It's increasing at all retail establishments that they go into. When I go to pick up, take out food in a restaurant, I see I have my mask on, as do the people who are serving me at the counter, and the same is true in restaurants across our state. So a couple weeks ago, we disclosed the conditions under which schools could go back into session in September, and the school districts have been really working hard, superintendents and their teams getting plans put together for their boards. We're clearly in scenario number 2, which is the yellow scenario. 2 of our criteria, the new cases on a daily basis at 56.5, which is very strong compared to where we've been in the last month or so. Our target there for green is to get that 56 number to 10. And our percent positives, which continue to be strong, driven in part, AJ, by your team's work in getting more people tested, and the testing that's happening in other venues at 4.2% positive. That's not today's number. Today's number is better yet than that at 3.8%. That's the number for, I want to say Saturday.
Week to week, yeah.
Week to week.
August 1st through August 7th.
There you go. So that's going to be our measure for the schools. Daily hospitalizations comfortably below the gating criteria there, which is 10 new cases, and we're at 4.3. So solidly in scenario number 2. And each of the school districts are in the process of developing their plans, as I said a minute ago, working hard with stakeholder groups. Most districts have large teams of teachers, staff, administrators, parents involved in putting those teams together, and they'll be presenting those to school boards. Most of the boards are still in the process of reviewing those plans. We do have an example of a hybrid plan that has been approved by the Cape Henlopen School District. Here it is, an example of a hybrid plan. Families have the option. They're giving families the option. They're surveying their families now. They did a survey earlier. I think about 60% wanted in-person or mix of in-person and remote learning, and about 40% of their students in an earlier survey wanted just remote learning. So they're going to have a mix of in-person and remote learning. Families have a choice. The elementary schools will have a remote option for parents who select that, but they'll be open 5 days a week for in-person instruction, space permitting, meaning the configuration of the classrooms. They're working closely, as all the districts are, with personnel from the Division of Public Health that have been assigned to each of the districts, and working closely on making it safe for children and staff. We know that children are not as susceptible to the virus, so the concern primarily is with teachers and staff there. And of course, then in the middle school and high schools, a remote option for parents who would like that, and then 2 days per week in person, again, space permitting, almost like a college model, if you will, where you go to class a couple days a week, and then you do your work at home, and you're working on papers and other assignments, a mix of remote and in-person instruction. So this was an example of Cape Henlopen School District. You can view their plan at capehenlopenschools.com/reopening. It's a very lengthy document that addresses many of the issues and all the concerns that stakeholders have, and we would recommend it to you to give you an idea of a district has developed a hybrid model, a mix of remote and in-person instruction with family choice. Most of the districts are continuing to work on their plans and prepare them for submission to the boards who ultimately make that decision. You may have heard this week that the DIAA, the board that regulates high school sports in our state, has come up with a recommendation or a plan to delay sports into the latter part of this first semester into December and determine what's happening on the ground. They looked at the various options there, and I think in light of the fact that some of the schools and high schools will be in a totally remote situation, and given the situation on the ground and the need for transportation and all the logistics of high school athletics have moved, like most of the states around us, by the way, Maryland, Pennsylvania, New Jersey, mostly a similar degree, with a same kind of a decision. So we did announce this week support, recognizing that the additional unemployment benefits from the federal government, the $600, has expired at the end of the month of July. That and the expiration of the action that we took to hold up foreclosures and evictions, that we've established a $40 million fund using CARES Act funding, thanks to the Congress and the President and our congressional delegation, Senator Carper, Senator Coons, and Congresswoman Rochester. We used $20 million that went to the state and $20 million from Newcastle County to basically recapitalize the DMAP program, which was a mortgage assistance program created in 2007 when we had the mortgage foreclosure crisis in our state. It was shut down for a while, and now we've reactivated it, along with the DHAP program, the Delaware Housing Assistance Program for those who need assistance, rental assistance, up to $5,000 for those in an emergency situation, and the resources goes to the landlord, or in the case of a mortgage, to an agreement worked out with the mortgage servicer. And so if you need information about rental assistance or mortgage assistance, you can find it at destatehousing.com/COVID-19, destatehousing.com/COVID-19, a $40 million fund with a $5,000 limit targeted towards families that are having problems because they're unemployed, not able to go to work, not able to pay their rent or pay their mortgage. We have some assistance to get them through what we hope will be a short period of time as we get businesses up and running again. And so our focus, in addition to responding with our agencies to the two severe weather events that we've had over the past week, is to really continue to push the curve down to reduce the spread of the virus, to improve the conditions here in our state with respect to COVID-19, and we're accomplishing that. And we're accomplishing it mostly because, largely because all of you are paying attention to the guidelines and restrictions. You're wearing masks when you're in public. You're keeping social distancing when you're in public. You're being careful when you go into restaurants to be separate and follow the instructions. And if you run a business like that, you're following the rules and regulations as well. For me, the overall objective, now we have something very tangible, two things very tangible to target, and that is to get more children back to school for in-person instruction, and two, to get as many businesses reopened and doing business in a semi-normal situation, certainly with more normal revenue than before, so that they can be successful and employ Delawareans. So with that, I want to turn it over to Dr. Karyl Rattay. We want to welcome her back. She had a couple weeks where we had other guests from the Division of Public Health, and we want to thank Dr. Hong and Dr. Pescatore for their great work and for filling in as we talked more about testing, particularly testing of teachers and school personnel, and AJ will talk a little bit more about that today. So Dr. Rattay?
Great, thank you, Governor. Our numbers are looking pretty good, as Governor Carney just said. Of course, we would like to see our numbers go down. Certainly, we do not want to see increases in our numbers of cases and our percent positive and our hospitalizations. For right now, it looks like we're in kind of a mild to moderate level of community spread. And so again, it's out there, the virus is out there, and it's really important that we do everything we can to prevent spread between individuals and especially outbreaks like super spreader events. And so I wanted to go over just some of the latest learnings in the research to talk about what we know now to best prevent the spread of this virus. Masks, face coverings, we've talked about them a lot, and we continue to have evolving, growing evidence that says wearing a face covering, wearing a mask is the most important thing we can do to prevent the spread of infection between individuals, to prevent super spreader events. When you look at some of these events, many in different places across the country or the world, these super spreader events almost always involve a lack of face coverings. And as we talked here before, I think one of the best case studies of showing the effectiveness of masks was these two hairdressers who saw 139, they served 139 clients, very close contact between hairdressers and clients for prolonged periods of time. And because everyone was wearing a face covering, the hairstylists themselves and the clients, no one got the infection. So again, face coverings are so very important. There are a couple of updates. In fact, in the last couple of days, there was a study that came out looking at different types of masks. And so I think it's really important to highlight the importance of the different masks and knowing what works the best. Face coverings that have multiple layers of fabric, which is the type that many of us do wear, these are the most effective. In fact, this study showed that these are almost as effective as N95s, which are the high-grade face coverings that healthcare providers wear. So these work really well. Unfortunately, these gaiter types of neckwear, it's just a single layer of spandex. A lot of people wear them while running and put them up when needed. Unfortunately, are not effective. This study showed that these really don't work well. In fact, you may even have an increased spread of droplets with these types of face coverings. So we want to make sure people know not to wear these gaiters to prevent spread, but really wear the type that has multiple layers. It's also very important that it covers your nose and your mouth, and it fits well around your nose and your mouth. CDC, Centers for Disease Control and Prevention, just yesterday put up new guidance around face coverings with valves. I want to make sure people are aware that valves are a hazard in that droplets, aerosols can go through the valve, and so it is not protective or preventive in spread of the infection. Additionally, face shields, which many people like because you can see the mouth. They also cover the eyes, which is good, but alone they are not adequate because they do not cover, they do not have a seal around the mouth and the nose. So important information about that. Also, I wanted to mention medical exemptions. There are a lot of folks who will claim they have a medical exemption to wearing a face covering, but the reality is true medical exemptions are extremely, extremely rare. It would be someone who has a lot of difficulty breathing, maybe somebody with COPD or serious severe asthma, and those are individuals who the science has made very clear are also at very high risk for severe consequences of COVID-19. So we recommend that people with those conditions for which they don't feel comfortable without or wearing a face covering, that they really should not be in public places where they are exposed to other individuals anyhow. I also wanted to mention age. You know, we've talked a little bit about this. The American Academy of Pediatrics and the and the Centers for Disease Control and Prevention have recommended all along kids 2 and up. It's strongly recommended. And what we are seeing out and about, in fact, I just was at the mall recently, I saw a lot of younger kids, 4-year-olds, 5-year-olds, very comfortably wearing face coverings. So we are seeing more and more that this is becoming a norm for children, and want to make sure that people are thinking about that as well. Additionally, a physical activity exemption. A lot of folks think, if you are physically active in a gym or walking around in a gym or even weightlifting in a gym, you don't need to wear a face covering. Really, it's only those who are engaged in vigorous physical activity, which is running, or running fast or cycling fast, stair climbing fast, where your heart rate is really increased. Those are really the only times when you shouldn't be wearing a face covering, and that's especially when you're indoors. When you're outside and you're distanced, it's fine to walk or bike without a face covering, but we want to make sure that folks who are in gyms lifting weights know that they really should be wearing a face covering, because that is a risky behavior. The World Health Organization recently came up with a really nice document around ventilation. So I wanted to touch base on this. This is, as we have seen over and over again, a really important factor for these super spreader events. And so in all indoor environments, workplaces, schools, churches, anywhere that people are spending time indoors, it's really important to make sure that there's fresh, clean air.